Hello everybody, welcome back to Radiology number 42. In this video, we're going to kind of continue on in that ICU related series on different medications. And today we're going to be talking about a specific type of medication called Ativan, which we'll later explore. I also want to kind of tell you guys that this is going to be the last video that I'm going to do for medication specifically, and then we're going to move on to that case study I've been kind of telling you about. So we're finally here. I also want to talk to you a little bit more about my experiences just in the general ICU and kind of throughout my hospital stay as well, and kind of move on from there. So yeah, let's get into it. So kind of just like always, we're gonna have this up here. There's no need for you guys to really comprehend this to an extreme extent. It's definitely useful to know it, but it's not really relevant in today's case study. So you can just move past that. Alright, so like I said, we're going to be talking about Ativan today. And it's kind of used to treat anxiety, it's used to treat insomnia, agitation. It can also really be used to kind of help patients feel like less nauseated. And if you kind of want to learn more about the side effects, they're pretty similar to any other calming type medication. That's kind of want to explain it, right? Because it kind of calms down your central nervous system. And because of that, it's going to have lower blood pressure, lower heart rate. It is going to generally make you more calm. It's going to make you more possibly delirious. It's going to have all of these issues that a lot of the medications that kind of calm you down and kind of relax you have, because you're kind of slowing down the body so much. Now, these medications are typically given to patients who may be really agitated. Like I said, they could be very confused. And especially in the ICU, when people come in from the emergency department or people suddenly wake up, um, they may feel confused. They may feel, why is there a intubation happening? Who are these people? Why is there something on my stomach, for example, or something like a Foley? So they may really kind of question what's happening, and it kind of helps calm them down and not get them as agitated. Now, it is also very prone to misuse, and by that I mean it's very easy to get addicted to it. So it's very critical for nurses and other staff members when giving out Ativan to kind of monitor the dosages they're providing and for what reason specifically. And to do this, they kind of use different scales. And these scales are very perceptive in a way that depends on how they're kind of judging the use of Ativan. So is it depending on the person's visual expressions, physically? Are they just like unbearable to handle it, or just simply saying their pain is extremely high, or they're like just like very not like unsure what they're doing, you know? So it's kind of important because anybody can kind of say they have anxiety. And it's important to kind of take that in context with their situation and what's currently happening with them rather than simply providing it to them. Now, granted, you always want to have the benefit of the doubt for your patient, but there are those few people who kind of take advantage of this, they get addicted to it. And it's like an opioid, makes it hard to get out of. So it's important to be careful. Other than that, that's pretty much it. That's gonna wrap up the ICU medications and emergency department like medication list. And we're gonna kind of move on to that case study, like I said, and then we're gonna talk more about my hospital experiences personally and some of the departments I worked in, what I thought about them. So yeah, bye bye.